Hey there, thanks for watching. So let's talk about where to start when you have a disc or an injury in the lower back. So that's always confusing. What do I do first? How do I figure out what movements or directions are right for me, right? So you can get a lot of information from the internet, you can get a lot of information from different chiropractors or physiotherapists, and they'll give you usually a packet of 5 to 10 things to try to do. But you have to break it down into one movement at a time and then reassess how that movement affects your symptoms or even your mechanics afterwards, so that you know if one thing is right for you and maybe something else is not right for you. The easiest way to start would just be to take some baseline. So for us here at EHS Physical Therapy Chiropractic, and then within my online program, the Herniated Disc Fix, we want to take a baseline of where the symptoms are. So in this situation, we're going to talk about lower back and probably like some leg type symptoms. So where are they? How far down? Am I all the way down to the calf? Am I just down to the back of the hamstring? So where are the symptoms, and then what intensity are they? So maybe for right now, we'll say this is about a 5 out of 10 on this right side down to here. So location, intensity, and then take some mechanical baselines. How does it feel when I shift my hips to the left? Does that pinch and increase pain? Okay, that's fine. As long as when I'm done, no worse. Just make a mental note. How does it feel when I go to the right? How does it feel when I bend forward? And how far do you go? Like, can you only go this far? And it's like, oh, that really pulls and hurts. That's like up to a 7 or an 8. And come back up. Okay, still a 5. And then hands this way. And then I want you to go one time backwards and see what that feels like and how far you can go. So monitor how far you can go and then the symptom response, what happens. Then the first thing I would try, because it's just going to be more likely than not for you to have success with this. Now, there are other videos that I can show you if it's not successful, but just let me know. It would be to go into extension and lying right off the bat. So lie down, come all the way flat, hips relaxed, hands low, okay? And then you're just going to press straight up as far as you can. Ouch, ouch, ouch. I feel it in my leg, and then I come back down. I'm not going to stay there. I'm not going to sustain it or just prop forever. I'm going to pressure on and off. So pressure on, pressure off. But you can't have the glutes tight. You can't be up like this. It's got to be down. Every rep, try to go just a little bit further with every rep and then come back down. Don't stay there until you can get all the way to your elbows straight. Or, and if you can, it's fine, at least get 10 to 12 repetitions in. And I want to know what happens, or you want to know what happens after every rep. Are the first 4 or 5 really tough and it feels worse in the leg, but then as you keep going, it gets easier? Do you feel like as you keep going, it continues to go further and further down the leg? That would be an understanding of a yellow light and a red light. So if you just feel a little bit of pain and then it goes away once you're done, keep going. If it feels like the more you do, reps 4, 7, 10, it starts to produce down, okay, that's red. Then we got to do something different. That's not right for you. But if you're able to get through them and it's no worse here, then stand back up, recheck your baselines. Okay, so where's the pain? Well, it's a little further up now. Green light. How much? It was a 5. Now it's a 4, 4.5. Okay, green light. That's going to be good for you. Keep going. And then retest your baselines. Hips to the right, hips to the left, a forward bend. Oh, I can go a little. Before I was like mid-shin. Now I can go down to here before that pain stops me. Okay, that's a change in the baseline, and then you want to keep going with those. You can't just stop after just one set of 10. You have to keep going 10, 10, 10, 10, and really build them up as far as volume goes throughout the day. But every time after, you're rechecking those baselines to see if you're making any progress.